Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to the Gastro Girl podcast. We are so excited to have the esteemed Dr. Vivian Asamoah, who is a gastroenterologist and integrative functional and precision medicine doctor at the Houston Gastro Institute in Houston, Texas. Thank you so much for joining me today.
Thanks for having me.
So, one of the things that we kind of talked about before we started our episode was there is so much information online, so many products. Everything is around gut health and your microbiome and all these, anything from soda to skincare can cure what ails you. And we just need someone like you to make some sense of this all. So, let's start with some of the crazy questions you get in your practice from patients. Just kind of set the stage for the confusion that may be out there.
Yeah, no, there's a lot. There is a lot of confusion. And I understand this can be really challenging for patients because it's for people out there, not even just patients, but just for people out there. Because it's challenging for me. And I'm a board certified gastroenterologist, trained in integrative and functional medicine as well. But there is so much out there. A lot of it started coming out, and most of this is marketing, right? So we're just kind of taking advantage of what is a sexy topic right now. And a really sexy topic right now is gut health. And so one question that I get quite often in clinic is patients just make an appointment, and I'm like, are you here for screening colonoscopy? And they are like, Dr. V, I need you to fix my gut health. And I'm like, where do I start? And I was telling you, I had another patient who was like, can you tell me more about my polybiome? And I was like, what is the polybiome? I was like, is this something new? I need to look it up. And she met my microbiome. So there's just so much out there, and it's so confusing. And, imagine having that conversation with patients where you're like, what do you mean by fix my gut health? So I think that's where the conversation, the educational piece starts, where I have to start explaining like, okay, what do you understand is gut health? What do I understand is gut health? And let's see if we can bridge that gap and be at the same place,
Well, what's so interesting to me is when I started, Gastro Girl a long time ago as a blog, it was digestive health.
Yes.
Right? Everything was, and gut health, like the gut to me is just one area. And now it's just this catch-all term, trendy, sexy term.
Yes.
So let's start with that. Like, what is the real definition of gut, and what should we really be calling it so that we have an understanding of what we're talking about? Is it digestive health? Is it our gastrointestinal system?
I'm going to explain it as a gastroenterologist would explain it. And we don't really like that term gut health. I think digestive health is a better representation of all the organs that are involved. Like when I think of gut, I kind of think of the lumen, and that's pretty much it. But we know that our digestive health has several key players, right? The lumen is one, the pancreas is another, the gallbladder is another, the liver is another. Like so many things play a role, right? But I do think the term gut health, although it's a super sexy topic, I think it has actually opened the door for more conversations between gastroenterologists and patients to now talk about the significance of gut health and how important it is. It is true that on social media, TikTok, IG, Facebook, things have just blown out of proportion. It's like when you open that door, the door opened a little bit too wide and everything is just flooding out. And now, you could probably even find an eyeliner that has probiotics in it. I'm serious. Like
no,
everything.
I believe you. I found skincare that has probiotics.
Yes. You can find, like a tampon, it has probiotics, like vaginal probiotics,
Right.
So I think the conversation has to start with the patients. And what I usually tell them is, we know that there is something called the microbiome. And the microbiome we're discovering and continue to learn about it because we don't know everything, is very, very important in terms of how our digestive tract functions. And even beyond the digestive tract, right? We talk about the gut-brain connection. We talk about how the microbiome influences the immune system. because 70% of our immune cells are in the microbiome. So first, starting by letting them understand that that microbiome is very important is the first step. Then the second thing I try and explain is, well, what is the microbiome, right? Because they're like, I have bugs in my belly, like, kill it, kill it, kill it. And I'm like, no, these bugs, be it bacteria, archaea, parasites, viruses, fungi, live in synergy with us. Like, we coexist together. Like, they need us, we need them. And they help our digestive tract actually function. They help with motility. They help with breaking down our nutrients so we can extract the right micronutrients and macronutrients, making neurotransmitters. They're so important, and they have all these roles. And so sometimes, you know, you've talked about SIBO on your shows a couple of times. You know, sometimes there's an overabundance or there isn't enough, and that imbalance is what can throw that gut health off.
Right. So when, as a consumer, healthcare consumer, whether you've been diagnosed and you're a patient or not, just someone that cares about your health, and you're being inundated with all of these products that claim to do all sorts of things for your gut health, what is your advice to us to navigate this? Like, you know, we may feel bloated. Oh, do we need this? And then, oh, you know, I feel constipated the next day. Do I need that? Or maybe I have a little GERD. Do I take this? And then we're just buying all of this stuff, and maybe we're feeling worse. So what do you tell your patients when they're doing this?
Save your money and get some shoes. I'll tell you where to start. There are two places you need to start. The first thing to do, I think, is kind of do a little bit of introspection, right? What has changed in my life? Am I eating differently? Am I eating out more? Did I recently incorporate like a new drink? Am I drinking more than usual? What's going on? So you do that introspection, because that really helps either your primary care doctor or your gastroenterologist when you go sit with them and talk about your symptoms, right? The second thing I would do is schedule an appointment with a seasoned expert, someone who's been studying this for God knows 10 years, 12 years. We've been doing training and going into fellowship and doing whatnot, starting with your primary care doctor, who may refer you to a gastroenterologist, or you may want to see a gastroenterologist, but talk to someone who can walk through your symptoms with you and be sure that they're not missing something else, right? The solution is not always just to take the next probiotic, the next drink that has a drop of probiotic. It's really to understand and get to root cause in terms of what's going on. So why just pop a probiotic when you don't even know what if you have H. pylori? I mean, what if you have celiac and no one diagnosed it, right? So introspection first. What am I eating? What am I drinking? How am I sleeping? Did I start a new medication? Like, what's off? And then, hey, let me go discuss this with this specialist, with someone who's trained, a trained expert, to help me walk through and make sure I'm not missing something else, right? Then with that specialist, you guys can actually start having conversations about what's going to be helpful for me and what is probably just a fad. And most of them are just fads, to be honest with you.
Yeah. And what we've learned too in the last decade or so is and you're perfect to be talking about this because you have this amazing background in integrative and functional medicine, which is so important because you bring in the diet, you bring in the behavioral,
Yes.
and a lot of things change in our life. I mean, as Americans, as human beings on this planet, we are so stressed. Everything is changing. There's so much uncertainty in the world.
Yeah.
And that impacts your digestive health and your overall health.
Absolutely, 100%. And that introspection is so important because I think sometimes we just don't even know, right? Sometimes we don't even know that stress is causing this. So just imagine a situation, right? Someone just maybe went through a divorce, just lost a loved one, and all of a sudden they start having all these gut symptoms, right? And they just start buying all these supplements over the counter trying to fix their issue. Had they started off by kind of doing some introspection, talking to a specialist, where now this gastroenterologist will ask the question, could there be stress in your life? Are you sleeping okay? And then you start connecting the dots. Well, those supplements won't help you, but maybe finding time to meditate, sleep better, do some mindful breathing, or start therapy is actually what's going to help you. And you just don't need to spend all that money on all that stuff. When that person that you're purchasing it from, trust me, doesn't know who you are. They don't know your story. They don't know your journey. So it's not a one size fits all. And just because it works for your cousin's sister's best friend's brother's sister's cousin's dog doesn't mean it's necessarily going to work for you, right? A lot of people are like, oh, my sister took this, my cousin. And I'm like, but she has a totally different microbiome and history and everything than you do. So let's work on just you. Let's personalize this for you.
And let's be real, like a lot of those people that are on social media are paid to promote a product. They get money to do that. They may not have that specific condition, and it can be deceiving. So can you help us understand? You talked about earlier, like the FDA, things aren't approved.
Yeah.
There's no evidence. There is evidence.
Yeah.
Like, how do we navigate that?
Yeah, that's a great question, because in gastroenterology, in medicine in general, we look at evidence-based, right? So, we may say, what are the best practices for managing or treating chronic pancreatitis or irritable bowel syndrome? Let's use IBS as an example. Well, we will look at all the studies and all the data that's being published on IBS and whatever medications, these specific medications. We'll look at IBS, even yoga and acupuncture and its impact on IBS. We will look at so many different things and then look at all the data behind it and actually grade the level of evidence and say, okay, this is level 1 evidence, level 2, level 3, level 4, and determine how effective that medication or that therapy is going to be to treat IBS. So this is data over time, thousands of patients, and what we call retrospective double-blind randomized controlled trials, right? So we're comparing placebo to something, right? Now, so that's how we work, and we use that evidence, and we know it works because if you have 10 patients who show up and you want to give them this particular treatment, you know that the evidence shows that it's going to work in 60%. So 6 out of 10, I'm going to see good results. So that's great. And a lot of the treatment that we give, at least prescription, is FDA regulated. So the FDA is actually testing, making sure the quantity is good, making sure the quality is good. When it comes to supplements, no, sir. No, ma'am. There is no regulation. There are some companies that'll do third-party testing, and you have to know where to look to see if this company actually did third-party testing. Most of what is sold on social media, they don't. They really don't. So even your supplements, I would say you want to get recommendations from someone who's knowledgeable about supplements and can tell you about the quality of manufacturing and everything. But it's not FDA regulated, and there aren't a bunch of studies. There are just not a lot of studies, right? And even if there are studies, we tend to find a lot more animal studies. So mice data, very small patient populations, some anecdotal reports. So you really have to work with someone who knows and understands. So there are providers like myself who, I have 3 wonderful dietitians in my practice. They're all virtual. We always try and recommend food first before anything, because food has the richest source of micro and micronutrients, everything, prebiotic, probiotic, we try and go there first. But I've also done a lot of research on herbal medications and looking at the evidence behind things like curcumin and glutamine and aloe and how much psyllium and what's going to be great for my patient, right? And making sure the right doses, and I'm also recommending the right concentration, the right amount. That's another thing too, right? Even if you look at the evidence base, you'll see that, one study is recommending maybe 2.53 grams of curcumin for a patient with IBD. And for a patient with IBS or something else, it may be a completely different dose, right? And there are issues with overdosing. It becomes very complex.
It is complex.
It's complex.
And then we've seen studies with drug-induced liver injury, and that has to do with over-the-counter as well as other types of drugs and medications. And just because something has evidence, right, like turmeric or something like that, doesn't mean you go out and chug a lug some turmeric. I mean, there's doses, and there's
doses.
It's all about shared decision making with your provider, and we've heard this term, and it's becoming more and more commonplace. But it really is. It's not just a trendy term. It really is important because you want to have that conversation with you, especially with someone that understands the full multidisciplinary and multifactorial aspects of a chronic digestive condition like IBS or IBD, because patients go down rabbit holes. I've done it myself. Oh, I think I need this. But I want to point out what you said about the evidence base, and societies like the American College of Gastroenterology come out with guidelines, and I was always so fascinated to see the evidence and what you were talking about. This is recommended because there have been a lot of studies. And this is how things like the low FODMAP diet, that when that came about, there was not a lot of evidence for a recommendation as a treatment, but it was effective for patients. It showed efficacy, but the evidence at that time wasn't there. Now there's many
There's a lot of
studies.
evidence.
Yeah.
Yes.
So that's what could happen down the line with these other things, but it does take time to get to that point.
Yes.
So that's why working with someone like you or someone with a similar experience can really help guide a patient, as opposed to them self-serving on all these. And it's easy to do. You see the Facebook ad pop up and the cute lady with, oh my God, she's not bloated. I want to look like that too.
But I get it.
Yeah, me too.
Though. I get it for patients, because sometimes they've seen a gastroenterologist, they've seen their PCP, they keep getting prescription medications and they're dissatisfied and they're not getting better. So they're searching for something. I mean, what is the population of patients? I think it's up to like 60% of our patients are using complementary alternative medicine and not telling us about it, right? And I think one, it's because they may feel like they won't be heard, right?
Yes.
They won't be heard, and the physician may not know about it to even be able to counsel or recommend. And two is probably because they think it is safe. Like, it's not going to hurt me, so let me just try. It is not necessarily safe. Just as you mentioned, interaction with medication. Curcumin causes iron deficiency anemia in high doses. You know, medications interact, supplements interact, even supplement combinations interact, right? And every individual processes things very differently. So I understand why patients do it. I understand the frustration, but it is not just because it's an herb, or, you know, it's not necessarily safe. So it has to still be monitored. Yeah.
So what is your advice for us, you know, who scroll through social media, maybe feel like we have IBS symptoms and we just want relief? Maybe we can't get an appointment quick enough at the gastroenterologist, right? Because there's a long wait often. Maybe should we work with a dietitian? Then we see these health, these meal plans and these meal kits.
Yes.
Do I need that? But then we don't want to start taking away foods, because even with, like you said about medications, if the low FODMAP diet isn't a one size fits all. So lentils may not bother me, but they may bother you, and that's a high FODMAP food. But that could be someone's source of significant nutrients. It could be their big protein or their big fiber. You don't want to take that away unnecessarily. So, I mean, help us out here. What should patients do?
I know this is a tough one. This is really tough. I think that in this conversation, we really wanted to share that we kind of understand, we get you guys. We understand why you're looking in all these places and why you are attracted by these sexy supplements and probiotics and whatnot. But if you're trying to really dig deeper into figuring out what's really going on and how can I get sustained relief, because you can't buy that $200 bottle supplement every month. For how long? Till you're like, how old? For 40 years, 50 years? No, you don't want to do that, right? So I think you really have to start, and I'm going to say this again, with acknowledging that you are a special and different person, and what's inside of you is very different to what's inside the next person, right? So you have to first acknowledge that. And then also take ownership of your own health. Educate yourself first, right? Just educate. We're talking about a lot of things online that are sort of like hocus pocus, but there's also a lot of great information online. There are really great sources, like the Gastro Girl podcast is a great source, the AGA, the ACG specifically. I mean, there are lots of great
Crohn's and Colitis
Foundation. There's the Celiac Disease Beyond Celiac group. If you want to learn more about the microbiota, there's the Microbiota Summit, the Health Summit group. Very, very great group. So educate yourself, find the best resources and educate yourself. And then start kind of through that education, it always starts with self. You're going to start doing some introspection, right? In our program, in our integrative program, we focus on the 3 pillars: nutrition, lifestyle, and just making sure the right tests were done. Okay, making sure the right tests were done. Where we see the biggest impact, it's not on testing, it's nutrition and lifestyle. Sometimes we won't test. We'll be like, whatever, you had a colonoscopy, we're not doing it again. We're not going to do your 5th colonoscopy. There's no point. But let's sit down and spend some time diving into your diet, right? Diving into your stressors, And when it comes to stressors, sometimes we go all the way back, like childhood. Were you breastfed? Were you not breastfed? You know, what did you eat? What were the traumas you went through, right? We know that a huge percentage of our patients with IBS, especially our female patient, there's definitely a history of past trauma there.
Yeah,
right?
and there's such a connection between
There's such a
trauma, whether it's sexual trauma or just trauma. Could be an accident. It could be something that happened in your family.
It could be warfare.
And your
It could be
gut.
something in the family and your gut, right? And so getting to that root cause means we're going to need to partner, shared decision making with our patient to get there, to kind of break the walls a little bit and figure out really what's going on. That along with diet. And then sometimes we'll do some additional testing because some people come to me and they're like, I've been eliminating 200 foods for the last 5 years. And I'm like, you just have celiac. Why didn't they test you? I'm like, it's just that easy. Or I'm like, hey, fructose intolerance, that easy, carbohydrate malabsorption test. Sometimes there's a simple test. Doesn't have to be a complicated, hoopla, expensive test. It's just a very simple test. Pancreatic elastase, your enzymes are low. Boom. Digestive enzymes. There you go. Fixed, right? So, you know, it could be simple solutions. So work with someone who's willing to take the time to dive deeper with you. And yeah, I mean, you are a special person. You're just you. You're not like anybody else. So
yeah, that's so important. Thank you for saying that for me and for our patients and our consumers that are listening. Speaking about tests, you know, on a positive side, there's so many options out there nowadays that there's many avenues to get to hopefully a symptom relief. But on the other hand, there are so many options and it's confusing. And there are new tests that have come out in the last couple of years that aim to target the microbiome. And then those same companies are prescribing, you know, hundreds of dollars worth of probiotics. So I'm not slamming any company, but I just want, from your perspective as an integrative functional gastroenterologist, what we should be aware of, what patients should be aware of before they go down that path of buying these expensive tests and products, as opposed to maybe working with someone like you that could actually guide them to the right test.
Right. I think the concern is that because a lot of this is not FDA approved, because people are just paying money, a lot of the companies are taking advantage, right? There's no supervision and then making their recommendations without, again, understanding that special you. Some of these tests are helpful. Some of them already exist with regular labs, but they've been combined with other tests to make them like package tests, right? So you have to work with somebody who understands, one, the validity of the test, right? Utility of the test, right? Whether it's really going to change your outcome by doing that test. What is it going to change? Are there other things we can do without you necessarily spending $400? And then if they feel that it is going to be helpful, what strategy are they putting in place? Remember, I don't believe that anybody needs to be on a whole bunch of supplements forever. Like I do have patients coming into my practice on like, they bring it like there's I'm like, where are your supplements? They like, they have like their little suitcase.
Oh God, suitcase.
It's like a suitcase. They have like all these 50. I'm like, oh my gosh, wow. How do you take this every day? And sometimes it's not because they're taking everything every day. They've just piled on over the years. My sister recommended, I got this online and this person recommended, and it's just too much. And they get overwhelmed and they can't do it anymore, right? So I think if you do want to do the test, don't do it alone. It's like, would you ever just go get a colonoscopy by yourself? And who's going to interpret? Who's going to interpret? And who's going to tell you what the path showed? And who's going to tell you, like, would you just go get a brain MRI on your own and then they find all these weird things and you're like, oh, I don't know. And someone just says, you wouldn't do that. You want to make sure that the person ordering the test knows how to interpret the test results and provide, you know, some evidence-based guided recommendations for sure.
No, that's really helpful. We've talked to a couple of experts like Dr. Stolman, and while those tests are promising, those microbiome, we're not there yet scientifically to be able to target what's missing or overgrown in your gut and know to target what strain of bacteria should be helpful to you. So, you know, can you speak a little bit about that? That's correct,
absolutely.
Right?
I think we're evolving, but we're not there yet. And I'm really hopeful that AI could get us there, artificial intelligence, because at this point, I think the microbiome, I mean, they say we've got trillions of bacteria in there, right? And when you get these test results, it's like 10 pages. I mean, I think we're looking at a skittle, a drop in the ocean of what is truly there. And so when patients come to me and they're like, I want the test I want, I'm like, okay, fine. But I with nuance, right? This isn't everything. This is really just a drop. And I say there are two things. We're not seeing everything. And then sometimes we're amplifying things that are not relevant, or we're, so it'll show like some parasite and the parasite is like actually a good guy parasite, right? But because it's picking up on the DNA, it's showing a cutoff that's positive, and everyone wants to kill everything that's in the red or positive, but it's not necessarily a bad thing. And that's why we say the tests aren't where they need to be yet. We don't understand all the clinical significance, because right now we're just testing, right? We have the tools to test, but what are we looking for and what is relevant and not relevant, right? So it has to be looked at, even with someone like myself who has the training. You got to look at the results with a grain of salt, right? Really.
And like you said, it's integrative. This is why you studied what you studied, because it's not just one factor. And I love that you're this focus. If I was a doctor, that's what I would do. I would do this integrative approach.
It's really nice to have that integrative approach, because you want to look at conventional medicine is very important. And when patients come to me and they're like, I have IBD, I don't want to be on meds anymore, I'm like, you're not talking to the right doctor. You need medication. Like, right. We need the biologics, right? You've had surgery, like you just need. So I can't get you off. That's not what I do. But I can help optimize your healing, right? I can help with nutrition. I can bring in the whole lifestyle component that hasn't really been discussed with you. We know stress is definitely a trigger with IBD and IBS, right? So I can bring that in. Our dietitians can talk to you about what to do when you are in a flare or post-flare, or if you're an IBD patient preparing for like a triathlon or something, we guide you in that, right? So yes, no, I agree with you. It's a little bit more complex, but I love that holistic approach. I really love my practice. Yeah.
No, it's amazing. And I know you got to get back to your practice, but as we wrap up this conversation, and I really hope we can do this again, and maybe people will have questions from this episode and we can follow up. So if you do have questions and you're listening to Dr. V, please post them in our YouTube channel, or email them at podcast@gastrogirl.com, and we'll invite Dr. V back on again, hopefully, if she's willing, and we can maybe answer some of your questions. But as we close out this episode, what are your final tips for consumers and patients about, navigating this landscape of an overabundance of information and products?
It is overwhelming. We get it. We understand and we empathize. It's really important. There's a lot, but focus on you. Focus on what you need. Focus on what's going to work for you. And make sure that you're not missing a severe, like something more significant in terms of diagnosis. We know that colorectal cancer rates are super duper high right now. And so I wouldn't play with your health based on what an influencer is saying, take this, take that, because you've noticed a change in your bowel habits and you're bloated all the time. There could be something else going on. So get some expert help. I think you owe it to yourself. You deserve that. As a wonderful human being. That's the only tip that's
perfect. And I'm so glad you mentioned colorectal cancer, because it is alarming how much that is increasing incidence, especially among younger folks under 50. And it's very disturbing. So don't try to self-diagnose or cure yourself. Definitely take Dr. V's advice and seek out a professional who can guide you.
Yes.
Well, thank you so much. I'm so grateful that you were able to join me today. And I look forward to following up with you and look forward to some of the questions that we'll hopefully get from this episode.
Thank you so much for the invitation. This was a lot of fun.
Yeah, it was so good.
Yeah.
Thank you.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.